Members, the next item of business are motions to approve 3 statutory rules, all of which relate to health protection coronavirus regulations. There will be a single debate on all 3 motions. I will ask the Clerk to read the first motion, then call on the Minister to move it. The Minister will then commence the debate on all of the motions as listed on the order paper. When all who wish to speak have done so, I shall put the question on the first motion. The second motion will then be read into the record, and I will call the Minister to move it. The question will then be put on that motion, and this process will be repeated for the remaining statutory rule. If that is clear, I shall proceed. Clerk, please read the motion.
That the Health Protection Coronavirus Restrictions No. 2, Amendment No. 11, Regulations Northern Ireland 2020 be approved.
Thank you, and I call the Minister of Health to move the motion.
Moved.
Thank you. And the Business Committee has agreed that there should be no time limit on this debate, and I call on the Minister to open the debate on the motions. Minister.
Thank you very much, Mr. Speaker. Speaker, the 3 regulations before the Assembly make a number of specific amendments to the coronavirus restriction regulations and the wearing of face covering regulations. But before I move to the detail of each of the SRs, I do, Mr. Speaker, feel that I must place on record my disappointment that neither the Minister for the Economy nor the Minister of Education agreed to my request for either or both of them to lead on the Assembly's scrutiny of these changes. Changes, I may add, Speaker, that were primarily only made following direct requests from those ministers on very specific and detailed amendments. But were I not to move these regulations today, they would have fallen. Yet, despite them not being my department's amendments, I suspect members will have agreed that it was important such an outcome should be avoided. Whilst in their virtually identical responses to me, both felt that they were not accountable for these regulations. I have already expressed my belief that during an unprecedented global public health crisis, there should be no space for ministers or the executive departments working within silos. That's why, Speaker, I especially welcome the previous commitment from the First and Deputy First Minister that regulations would be tabled and led on and in the Assembly by the relevant Minister. Although this very regrettably was not the case today, I would wish to thank the other ministers that have shown or are shortly about to show generosity of their time and support, namely the 2 junior ministers, the Communities Minister and the Justice Minister. Speaker, moving on to the issues at hand, SR 232 and 239 amend the Restriction No. 2 regulations in a very specific and narrow way. The amendments actually achieve the following. In the No. 11 amendment regulations, they ensure, firstly, that the categorisation of tourist accommodation within the restriction regulations follows the existing formulations in the Tourism Northern Ireland Order 1992. This will simply ensure clarity around types of accommodation which were not explicitly set out in the original drafting, such as hostels. Secondly, they ensure that people who rely upon a carer are not prevented from taking individual exercise. We have made sure that where a person needs assistance entering a swimming pool, for instance, that is not inadvertently restricted. Thirdly, they ensure that the restrictions upon the close contact sector do not extend so far as to prevent make-up and hairdressing for film and television production underway during the period of the restrictions. My department was made aware of the impact that the restriction would have had upon ongoing productions and responded by making this exception upon the condition that extensive protective measures were in place. The industry standards are high, and I understand that this has allowed those productions to continue. Fourthly, they ensure that motorhomes are categorised with touring caravans within the regulations, so that where sites for touring caravans are closed, the same restriction is placed upon the sites for motorhomes. In the No. 12 regulations, the amendments ensure that there is no restriction upon school physical education as a consequence of the restriction upon sports events. This would clearly be an inappropriate restriction upon children's education and a barrier to schools delivering the curriculum. And they ensure that where there are tables set up outside a bar or cafe, these are treated as part of the premises and subject to restrictions as much as where there is outside seating. We were made aware that there were instances of business seeking to subvert the intention of the original restrictions by having stand-up tables which would have allowed customers to loiter around the premises as much as if there had been seating, and thereby undermining the effectiveness of the original restriction. These may be small matters in themselves, but they are intended to ensure the integrity of the Executive's restrictions and to reflect our understanding of the impact that the restrictions are having on people. So some of these amendments tighten restrictions slightly, others loosen them slightly, and in anything we have done, we have sought to assess the risk of increased infection associated with loosening restrictions and the risk of serious negative consequence for individuals and the community if legitimate and valuable aspects of life are restricted. SR 233 amends the wearing of face covering regulations. These amended regulations were made on the 29th of October and came into force immediately. Their purpose is to mandate the use of face coverings by post-primary pupils on home-to-school transport and on public transport. Previous amendments to face covering legislation had extended the requirement to use a face covering on all buses, coaches and taxis, but not school transport. An exemption existed for children under 13 years of age. The amendments to the regulations have been made so that only children who are not yet at secondary school are now exempt from wearing a face covering on school transport or public transport. The term junior pupil not yet receiving secondary education exempts children under 11 and 6 months who are not yet at secondary school from wearing a face covering. The exemptions from medical and other requirements remain unchanged. Mr. Speaker, these regulations were put in place before school resumed on the 2nd of November 2020, and I beg to move.
I call on Pam Cameron. I call on Colm Gildernew, Chairperson of the Health Committee.
Gormagad, Ceann Comhairle and Gormagad Leishan Ira. Thank you to the Minister for coming today to make this statement. The Health Committee was briefed by the departmental officials on the 3 statutory rules on the 12th of November and agreed to recommend that they be confirmed by the Assembly. In relation to Amendments 11 and 12 to the number 2 regulations, members raised issues of process, inquired about consultation and alignment between departments and asked about equality considerations. On process, the committee asked officials about the potential moving forward for the department to resume its engagement with the committee at the stage of policy development, though clearly this would be a subject to a degree of uncertainty given the circumstances. No assurance was offered on facilitating better scrutiny, something which remains of concern to the committee. The number of sets of amendments and volume of technical amendments were also raised. Officials explained that this results from working at speed to respond to rapidly changing circumstances. We were informed that a cross-departmental working group meets weekly to consider the policy detail resulting from executive decisions, but that, given the time constraints, gaps are hard to avoid, though they can be plugged quickly via amending regulations as we have before us today. It was suggested to officials that further consideration be given to cross-departmental considerations of policy alignment in the current context, with one member citing an example of street furniture being installed during a period of restrictions on hospitality. The committee also probed consideration of equality issues in the absence of formal equality impact assessments. Officials advised that the human rights context and the proportionality of restrictions was considered in respect of each statutory rule, and that the Department sought to strike a balance between the impact on rights generally and the impact of not imposing restrictions, given the nature of the pandemic. Pressed on the adequacy of the current approach, the officials conceded that there was recognition of the need for more granular consideration of equality issues, and that how this might be approached was under consideration. Turning then, Ceann Comhairle, to the face coverings amendment, members were advised that the percentage of passengers wearing face coverings on public transport had gone up from 10% to 85% as a result of them becoming mandatory in that setting. On this basis, it was hoped that this rule would also prove effective in extending the requirements to post-primary children on home-to-school transport and public transport. It was suggested that officials consider the inconsistent messaging in continuing to exempt children from wearing face coverings in retail settings. The rationale offered was that social distancing is more feasible in many retail settings, unlike public transport, but the Director of Population Health undertook to consider the messaging point further with the Face Coverings Working Group, which is chaired by the Executive Office. Officials were also asked about any potential harm deriving from unhygienic practices in the use of face coverings, but advised that, on balance, research showed that there remained a net benefit from the wearing of face coverings. Agreeing on the evidence in favour of face coverings, members inquired about plans to widen requirements to use face coverings in indoor settings generally, and the extent of the Department's research on international experience and best practice, particularly that of South East Asian countries that have successfully reduced transmission of the disease and where face coverings have been routinely used for some time. The Committee intends to seek a wider briefing on the evidence in the new year. Finally, on foot of questions around the links between sets of regulations, officials confirmed that almost all face coverings regulations are now separate and will not fall with temporary additional restrictions. So if I may now, Ceann Comhairle, I'd like to reflect a few words as Sinn Féin spokesperson for health. The statutory rules we are discussing were made and came into force in late October and early November, with much of the content relating to clarifications, for example, close contact services working in TV and film productions. This House must take the measures and restrictions seriously, as they impact in many ways on the lives and livelihoods of the public, even if those restrictions are time-limited and subject to change in a few weeks' time. There are two things that I believe are vital: communicating a plan and a purpose and strategy, and importantly, putting in place the means to achieve that strategy. I welcome any clarifications that can be made. It's better that they are not needed, but when they are needed, it is right to get them made and put through. On the issue of achieving the desired outcome, I want to raise the issue of compliance. We have heard how face coverings on public transport saw compliance increase to an estimated 85%. I would like to see that further increased where possible, and that will mean enforcement. It also means, and this is a crucial point, that we need to ensure that everyone is aware of what is required and, importantly, that there are no barriers to compliance. For example, that means supporting business with grants, providing workers with statutory sick pay, and ensuring that people have masks or something to cover their nose and mouth where needed. And in a situation where people are struggling financially, cost of masks is an issue that I think we need to consider. Ceann Comhairle, as we enter the winter months, those remain some of the challenges and tests that will not go away. We must work effectively together to meet these challenges in the weeks and months ahead.
Thank you, Colm. I'm going to call Pam Cameron.
Thank you, Mr. Speaker. And I intend to be fairly brief this morning. And at the outset of this yet another coronavirus health restrictions debate, I want to put on record my thoughts are with those nearing the 1,000 mark of people or families that have been bereaved and very much affected by this whole pandemic. Obviously, these restrictions and regulations do put barriers away of normal life, of everyday life, of the right to work and the right to family life, and indeed even the right to public worship. The Health Protection Coronavirus Restrictions No. 2 Amendment No. 11 Regulations Northern Ireland 2020 sets out the changes to places where restrictions will apply and gives additional clarity, including some exemptions to the restrictions, with the biggest impact on restriction obviously is to business. And it's worth remembering that businesses, these are businesses that have bills to be met, food to be provided, and I have to say in recent weeks I've had many businesses across South Antrim contact me in utter despair at not being able to pay the bills or feed families, and it is a reality, it is not an exaggeration. And yet, while we can produce restrictions, it would appear we can't produce the money in a timely manner to support these people for whom we ask so much at this time. I think it's right that we put on record the sacrifice that those people are making. It certainly isn't good enough in my book, and I would appeal to the Finance Minister to do more and to do that faster. There is... I will indeed.
Appreciate the member's words. As an MLA, I am inundated by businesses who genuinely don't know if they can keep their door open. And I would ask her, would she also be fair and make the call to the Department of Economy and her party colleague, who absolutely needs to step up quickly?
I thank the member for the intervention, and certainly I welcome the cross-executive work that is going on, and certainly all ministers that have responsibility in areas of support, we would ask them all to put their shoulder to the wheel. So, Mr Speaker, there's a great deal of confusion once again it has not been helped by the ambiguity in the regulations and the late publication of these regulations. Businesses that can have multiple facets to their business, unsure whether they can open at this time and whether they can sell non-essential goods. And on the other hand, businesses who entirely sell so-called non-essential goods, watching their high street competition selling the same products as that they are forbidden to sell. I do welcome within the Health Protection Coronavirus Restrictions Amendment number 12 regulations that provides for physical education to take place in schools and other educational settings. We do know how important this is as part of a child's school day and the physical and mental benefits that exercise brings. Yes.
I thank the member for giving way, and I totally agree with her on the need to put a focus on children's physical activity to ensure mental and physical well-being. But would the member for South Antrim concur with me that it is also important that we look at the adult population's mental and physical well-being in relation to the restrictions? And I think particularly of the many thousands of gym attendees across the province at the moment, because for many of them, their only form of exercise is through that gym setting. And with the onset of winter, with dark nights and indeed adverse weather, sometimes that gym setting is the only way in which they can have that physical exercise. So would the member agree with my call, and indeed the committee's call, for a dialogue between the Minister and the Department with those gym businesses and attendees to ensure we can find physical and mental well-being in these winter months?
Can I remind members to stick to the scope of the regulations in hand this morning? Thank you.
Okay, thank you, Mr Speaker, and thank the member for his intervention. And I do certainly see his point completely, and certainly from my viewing, even after simply walking the dogs yesterday outside, I was very aware that my walk on a fairly small path through a forest down to the loch was very crowded because of the knock-on impact that the closure of the likes of gyms has created, with cyclists and runners and entire families out doing their best to do something healthy and get out there and look after their physical and mental well-being. So there is a knock-on impact of these closures as well, certainly. Mr Speaker, we've had these debates on many, many occasions, and to be honest, much of it is repetition. And maybe that is because as a society we are in a cyclical crisis. We make progress, we regress, but we do want to break this cycle and the current lockdown. These restrictions, albeit flawed in many ways, are rightly aimed at driving down the cases and in saving lives and protecting our health service from being overwhelmed. I very much welcome that our clinicians are doing their utmost to keep as much of our health service going throughout the second wave of coronavirus, and we must all look on the restrictions as an opportunity to do the little bit that we can to support our NHS staff in keeping as much of the health service open and operational, and we can all help by restricting our movements. This is another chance for us to do the right thing now, or we will be back on the cycle once more, again and again. Today's amendment number 3, which refers to the wearing of face covering, extends to the requirement to wear a face covering to post-primary school children on school transport and on other public transport. So, Mr Speaker, I will finish yet again with an appeal to all to wash your hands, to wear a mask, keep your distance from others, and that includes family that do not live in your house, and cut down on your contacts. Protect your friends, your family and your colleagues and theirs, and that's what we ask of everyone. And if we all do it, we can indeed break this cycle. Thank you.
Thank you, and I call Colin McGrath.
Very much, Mr Speaker, and I welcome the opportunity to participate in this debate today, and I also acknowledge the Minister for Health's insight into the DUP ministerial's version of teamwork. But we all know that a team is only as strong as everybody playing their part, and I would hope that all ministers will do what they can to try and help with the workload of responding to COVID. The 3 regulations that we are being asked to ratify today are those that were laid before the Assembly on Thursday, the 29th of October. And as I do, I would like to pay tribute to all of our healthcare staff who continue to fight this invisible enemy in the wards, and corridors of our hospitals, our care homes and houses, and extend deepest sympathies to the families impacted with the passing of loved ones. Mr Speaker, members will be all too familiar with the process with which these regulations and amendments are laid in this Assembly, and that some of the regulations that we give consideration to today and try to wrestle with the decision as to whether or not we should agree with them have actually lapsed. Surely there must be a better way for us of doing this business. I think a better approach would be that these amendments are drafted. When they are drafted, that they're brought to this chamber for debate, for discussion, so that we can interrogate the decision that's been taken, but also ask the questions about many of the various impacts of the decisions, so that we would be able to understand what that process is and then go back to our constituents and detail to them. It's not surprising to yourself, but yes, go on ahead.
Thank the member for giving way, and I know he has passionately articulated that point at the committee. Would the member agree with me that one of the increasingly difficult parts to justify in relation to the delay in regulations coming both to committee and this House is that, for example, on the Thursday that the Health Committee does meet, we have a situation where the new regulations are in fact coming in on the Friday morning, meaning that there is a communication breakdown as to what should apply and what is previously applied.
I thank the member for his intervention. Maybe just to simplify, I think there's a better way of doing it. I think it wouldn't take much to sit down with a blank page and work out what's the best process for making sure that we can participate in the decision-making, but also understand the decision-making, because then if we understand it, then we can go out and articulate that to our constituents. But how often have members in this House with a regulation had a phone call or an email from a constituent and went, I don't know the answer to that, and then set about the difficult process of trying to find that information out. But to come to the regulations themselves, Mr Speaker, the first of these issues clarify what was previously lacking, specifically in regard to self-catering accommodation, indoor exercise, closure of hostels, caravans, clarity on where close contact services can operate, and some restrictions on outdoor seating. The second provides for clarity for physical education to take place in education settings and clarity on facilities adjacent to hospitality premises. And finally, the third legislates that post-primary school children must wear a face covering on school transport and on public transport. And I do want to say at this stage, Mr Speaker, and place on the record, what does it say about us that we are legislating for children to wear face coverings, when an MP who has sat in this House and was a minister in the executive once upon a time continues to throw this back in the faces of those children, that believing that he is above such practices, but certainly takes the money from their parents via their taxes to pay for the face masks that he doesn't wear properly. To his colleagues sitting opposite, I implore you to get this knocked on the head, even at this late hour, 8 months in to a worldwide pandemic. Now, Mr Speaker, obviously many changes have been made to the regulations from the one that we are discussing today. We are in a period of lockdown with non-essential retail closed and many other elements of daily life restricted. And I have to say, though, that my experience of the most recent regulations has been as unhelpful as the past ones. What is non-essential? What is homeware? How much of your produce constitutes significant? What about car washes? Are music lessons educational? Are Irish dance classes different?
Sorry, Mr. Colin, could you go back to the regulations, the scope of the regulations? You're straying well beyond into the new ones.
Thank you, Mr Speaker, but the regulations be made for me.
I'm about just like some clarification. We've debated a sequence of these regulations for many successive weeks. On each of those weeks, the Chair has permitted, in recognition of the reality that events have moved on, has permitted discussion which brings the matter more up to date. Are you today making a contrary ruling so as to restrict us to regulations, some of which are no longer extant or even relevant?
Well, first of all, let me assure the member that I am fully aware of the rulings around scope and how the speakers or the deputy speakers will conduct the debates. I'm involved in the decision making of that to make the call on that. So I'm fully aware of the nature of the debate and how the debate should be conducted. Very often, ministers and others have actually widened the scope of the current regulations, and that's why we have been given all the latitude necessary to members to do their best to explore these issues and give robust scrutiny to them. What I'm trying to do here this morning is to remind members, let's try and stick to the scope of the current regulations on the order paper today. That's not a new regulation. The Deputy Speakers have tried on a number of occasions to try to bring members back to the debate in hand. So we do give latitude, and we will always give latitude to allow members to do their job in terms of exercising full scrutiny and accountability. But at the same token, I think it's reasonable, and all the Deputy Speakers and myself have frequently and routinely tried to keep people within the scope. So that, I hope, assures a member.
Thank you very much, Mr. Speaker, and I will of course comply with your ruling, but it does once again show the farcical nature of the debate that we're having, that we must curtail ourselves when the public out there are suffering from the regulations that have been enacted over the last number of weeks. They are suffering. They have questions about regulations. They have concerns about regulations, but we can't discuss them in here in a timely manner. I think that's quite sad, because it raises question after question after question. And we are given an email for regulations to seek that information, but sometimes it takes days, if not weeks, before you actually get an answer. The communication by the Executive Office about the restrictions lacks detail, lacks information, and creates more questions than it does answers. The only thing that is certain about the Executive Office's communications of regulations is the eye-watering budget that it has to spend on that communication. And of the businesses impacted, Mr. Speaker, they apply for help and make an application, and for some, that application falls into a big dark hole, and they don't see or hear anything for weeks about their application, not knowing if they will or will not get financial assistance so that they can comply with the regulations. People are hurting, and the Executive supplies help, but it appears not everyone is getting that financial help in a timely manner. The Department for Economy and its Minister need to pull up their socks and get their part of the COVID response right. People's livelihoods are depending on it. In conclusion, Mr. Speaker, I continue to accept the need for these regulations and their amendments, even if they have lapsed. The health and well-being of the public at this time remains my #1 priority. But while I do support the motion before us today, I continue to implore the Health Minister to examine, is there a different way that we can do these? Thank you.
Thank you. And I call Paula Bradshaw.
Mr. Speaker, I don't intend to speak for long. All that needs to be said about the regulations we're talking about today has already been said at committee in a very long, interesting session with the departmental officials about the challenges in developing such regulations at speed. And I very much appreciate that what we're discussing today are technical amendments in some ways to give greater clarity. I just wanted to pick up on the point that the chair of the committee raised in greater detail, and that was the need for greater cooperation across the departments. In my constituency in South Belfast, the Department for Infrastructure introduced new parklets, they're called parklets, where people will have seating that they manage, but it's just outside a coffee shop, and people are now sitting there using it. So it's not that the businesses are providing the seating, it is that the department is doing so. Now, that was raised with me in the context that other business owners down the road, coffee shops who were allowing takeaways, coffee to take away, felt a wee bit aggrieved, but I thought it spoke to the need for the departments to work together so that anything that's taken forward actually is around trying to achieve compliance around these public health regulations. I also would like to place on record my appreciation for the fact that the face coverings have now been extended to all post-primary pupils. I think that was causing confusion and no doubt difficulties for those who are on the trains to actually decipher who should be wearing them and who shouldn't. But again, this sort of brings us to the wider chaos that's been surrounded in the development of the regulations since. At the committee session, it was pointed out that there was a period of time required between the Executive agreeing and announcing new restrictions and the regulations being drafted to put these into effect, and then there's a further period of time while they are ironed out by further amendments such as we've seen today with numbers 11 and 12 that we're nominally debating. Mr Speaker, I'm not going to say much more, but I did want to pick up on a point from Jonathan Buckley, who's joined the Health Committee recently. I'm one of those gym goers who try to go every morning but probably only make about 4 or 5. I have to say last Thursday morning there was a sense amongst, and maybe it's just the gym I go to, but there was a strong sense that it was only 2 weeks that we're closing these, that they understand the need in terms of the capacity within our health service, the need to get this right so that we're not having a lot of infections coming up and over the Christmas period. So I do have a great deal of sympathy for those people who run independent gyms, those people who maybe their salaries are affected, but I do think amongst gym goers, sure.
The member's point is very relevant. As another one of those gym goers, albeit it may not show, one of the things that I heard from the trainers, the one-on-one trainers and others that were in the gym that owned it, if they could get the financial help in a timely manner, they'll comply. It's not an issue of closing. They understand what they have to do, but it's about getting the financial help in a timely manner that would help them to be able to do it.
And I think that this strikes the heart of it, that they want to, they don't want outbreaks in the gyms, they don't want anybody that they're working with to be affected, and they do see the go ahead.
But the many gym users that I had been speaking to, in particular even actually a correspondence from a nurse, found that the gym setting was the only place that she could take care of her own mental and physical well-being. I can understand where some may come from, but there's many gym users across Northern Ireland and owners.
The member is now stretching.
That it's not financial, it's mental and physical well-being is the concern. Thank you.
Speaker, I think we'll bring that to a close, but I was walking this morning at 7:15 along Loch Short and I got their head blown off me, so I do understand why it doesn't suit everybody to go out walking early in the morning. But Mr Speaker, I think that the last point I'd just like to say is it just to urge the public to stick to the current regulations just brought in. I understand the frustration at the situation and at our politics. But there is no other reason for us to introduce such tough measures than the protection of public health and of our health and social care system. And so instead of seeking loopholes, let us understand one thing: the more closely we stick to the regulations, the sooner we can ease them. Thank you.
I call Gary Middleton.
Mr Speaker, like others, I want to pay tribute to our health staff for the tireless work that they've been doing, all of our frontline workers, and indeed my thoughts and prayers are with all of those who are currently affected by the COVID virus. Like others, it does feel a bit repetitive speaking on these issues, given the fact that, as I say, they've already been implemented. Nonetheless, I think it is important that we do say a few words on those. Just to, I suppose, speak to the point made by the Health Minister in his opening remarks around the silo mentalities. And we do need to be mindful that working in silos is not helpful. I've said in this chamber before around the executive and how the executive works is that it is important that when decisions are taken that as uncomfortable as those decisions may be for individual members, including myself, it is important that we do show a united front when we're going out and delivering those messages. But that also applies in terms of the schemes, because I do see members across the chamber who will, of course, be first out, tripping over themselves to welcome initiatives from the likes of the Economy Minister, but then on the other hand, be tripping over themselves to be the first to criticise. So we do need to work on that collective basis and ensure that we can deliver the outcomes that we want to see. I will indeed, yes.
I think the member will appreciate that this is not about anyone tripping over anything. This is about ensuring that those most in need receive the financial intervention in a timely way to ensure that they can make the best decisions in the interest of the public, but also in terms of their own business as well. And that is why we are tripping over things to ensure that they get that necessary financial intervention.
Thank the member for that, and I don't disagree in that what we do. Yeah, go ahead.
The member will note when the last speaker was on his feet, he wasn't tripping over himself to defend Belfast International Airport, where his minister hadn't, up until last week, actually made any intervention in relation to those, but indeed rushed out to get money to City of Derry Airport.
Deputy Speaker, I thank the member for that. I think the point that we're trying to get to in all of this, we all want the best for our constituents and the businesses. What we don't want to see is the continuing politicisation of a lot of these issues. Just for point scoring and Facebook and Twitter videos and all of that, look, the public can cut through that stuff. I think it is important that we lend support to the ministers who are trying hard, and particularly to the officials who are doing their best to try and support those who need to get the support. In terms of the Amendment 11, obviously it does bring clarity and some welcome clarity to the issues and to the regulations. So I think really that's fairly self-explanatory. In terms of Amendment 12, which relates to the physical education within the education setting, I think that is vitally important. That was rectified, and I do welcome the fact that that was put forward by and pushed forward by the Minister for Education. And we know that physical education goes beyond the physical exercise element and the good health, but it's the mental health impact that that has as well in terms of those young people. And I do want to come on, Principal Deputy Speaker, because it is relevant in terms of indoor exercise and it has been mentioned. But I do take issue with the fact that gyms have not been allowed to operate in terms of that indoor exercise piece for adults, because despite what some members are saying, this is not a financial issue for those gym owners. They place the well-being of their customers above the financial incentive that they have for the 2 weeks. And that's a frustration that I have, and I know that the many gym owners that have been on to me have been deeply frustrated and very concerned about the customers that they have, because many of them, the gym owners, are actually assisting them with recovery on various issues. So that's a point that I will indeed.
The member for giving way, and I won't labour on the point, but for many of the gym users and gym owners, what they would like to see is a communication, a conversation about, is there a way forward which could potentially allow for gyms reopening in a safe and compliant manner to ensure that physical and mental well-being?
I agree with the member's point. And these regulations, as the Minister stated at the outset, these are cross-cutting issues. They go across various departments, so it's important that all departments have a say. And it goes back to the actual restrictions themselves. We need to ensure that all of the views of all of the ministers are taken on board. We know that the Economy Minister has been fighting hard in terms of the businesses and getting businesses reopened in a safe and timely manner, but that's a cross-cutting issue, and we need all of the executive ministers to be heard in that respect. And in terms of again, bringing it back to the amendment in regards to the face coverings, I think that it is important that clarity has been given, particularly to those post-primary students. I know that many principals welcome that clarity. There were concerns raised at the time around enforcement of that on buses, for example, and on their way, but it seems to be that there's a level of compliance around all of that. Just in closing, Principal Deputy Speaker, I do want to say that it is important going forward that we try and have a consistent approach. As I say, if we're allowing physical education to happen within schools, which is the right thing to do, we need to allow for that exercise to take place within indoor and safe settings as well. So I would just urge that. And just to remind members as well that obviously going forward over the next number of weeks, it is important that we get out of this endless cycle, and the way we do that is by adhering to the guidelines and ensuring that we all keep each other safe over the next number of weeks. Thank you, Principal Deputy Speaker.
Thank you. I call Mr. Pat Sheehan.
I've got a free last Ceann Comhairle, and I welcome the opportunity to speak in this debate. We've been here before, covered a lot of ground, and I suppose I always think it's important to contextualise why these restrictions are needed. And the simple reason is that we need to protect our health and social care system. We can't allow it to be overwhelmed in the face of this pandemic. And years of underinvestment in the health system has meant that we don't have the capacity that we might like to have to deal with the upsurge in the numbers of people who become ill as a result of this pandemic. And it should never be a case that groups of people with one illness are pitted against groups of people with another illness. The fact is there are people ill and they have to be treated. And unfortunately, clinicians have to make ethical decisions on who should be treated first and who shouldn't. But basically, the restrictions are in place to protect life, to try and reduce the rate of transmission, to protect our frontline workers, and to protect society in general. And, you know, I suppose drafting legislation is never easy at the best of times, and it's all the more difficult when all this legislation is coming at us in haste, and we don't have time for the usual scrutiny that would take place. So it's inevitable that sometimes anomalies are going to appear, mistakes are going to be made, and clarification is going to be needed. But some prominent people in society speak out angrily. Sometimes their language isn't maybe as diplomatic as it ought to be. I'd say if we were using similar legislation, we'd be castigated from the high heavens. And some of these people may be brilliant musicians, fantastic chefs, or people who can run great hospitality businesses. But I'd love to see their credentials on public health and dealing with pandemics. So I would ask everyone in society, you know, we have a difficult job. Some people are more concerned about their own narrow interests, but political leaders have to take account of the society in general and the needs of all our citizens, and the need to protect our health service, the need to try and save people's lives and to stop people from becoming ill. So those are issues in the context of the restrictions, and even these restrictions today, that we need to be cognizant of. Well, one of the amendments we're dealing with today is around the issue of masks, and I would say to the Minister, you know, that I have been banging on about masks from as far back as late March and April, about the necessity for them, the evidence that was mounting, particularly in other countries, and the science that was coming to the fore telling us that the wearing of masks does reduce the transmission. And I'm glad to see that we did actually implement the legislation to make it mandatory to wear face masks in certain circumstances. And that's good. But there is an issue, and my colleague raised it earlier, about the cost of face masks. And we know from what we have seen in many other countries that face masks were free to the population. And I think there should be at least some circumstances where the Minister should maybe consider making face masks available free of charge. Another issue that we should all welcome, and I know it has been by a number of speakers so far, is the clarification around physical education in schools. I mean, I think we came in for some ridicule around the issue of PE in schools when the legislation around PE in schools was first mooted, and this clarification was absolutely necessary, and I welcome that. We had a ridiculous situation where fewer students could take part in outdoor physical education than are actually allowed indoors in the classroom. So that was an issue that needed rectified, and thankfully it was. I don't intend Friú Las Cion to go on for much longer here today. You'll be glad to hear. But there is an issue around compliance and enforcement around these particular restrictions, but also around the restrictions in general. And without wishing to stray off the particular focus of these amendments, I think a good example of the issue of compliance and enforcement, and I put those terms in inverted commas, if anyone saw the Spotlight programme last week on contact tracing, about the contact tracing system in Wales, when contacts were traced by the contact tracers, they were followed up with phone calls, and if they didn't answer the phone when they were in their period of isolation, contact tracers actually called to their house. And essentially, the rationale for calling to the house was to see if the person who was isolating needed support. But I'm sure everyone could easily imagine that there's an element of enforcement there too, because if the person who was supposed to be isolating wasn't there, then that raises further issues. I suppose that's an issue around contact tracing, and the Minister knows my views well on that, so I'll maybe just leave it there rather than drifting further off on the issue. But one final question directed at the Minister. I suppose the question is, and many people out there need to know the answer to this: when is the Executive going to announce what the situation is going to look like post the 11th of December? And could I advise that rather than leaving it to the last minute, all of us ending up on the cliff edge, as we have done this last number of weeks, that an announcement should be made about what the situation is going to look like after the 11th of December. An announcement should be made about that here today.
Thank you. I call Mrs. Martina Anderson.
I think that before talking about these amendments and the restrictions, I, like others, want to send my heartfelt sympathy to all those who have died on the island of Ireland and indeed across the world of COVID. And also to the many more, the thousands who have ended up in hospital. And we know that people are struggling with what's called now long COVID. We also know particularly young people who have had it and thought they came through it okay. And now we're hearing that there's maybe a bit of a pattern emerging with some young people ending up with pneumonia and other illnesses as well. And I think it's in that context that we all remember that the five parties in the executive have to make difficult, challenging decisions which impact on our daily lives. They all agreed that more interventions were necessary before the end of this month to curb the spread of the coronavirus and to prevent our hospitals becoming overwhelmed. Hospitals like Altnagavin and Derry were already struggling before COVID with awful waiting lists and people left at times on trolleys, being taken home by their families rather than having them lying in wait to be seen. So COVID, without doubt, has made a bad situation worse. And I have to say, the journey to the amendments that are in front of us today, 11, 12 and 3, the journey to these restrictions before us was somewhat unedifying, as we did witness the DUP, the largest party in the executive, using a veto to hinder the majority of the power-sharing executive, who represent an overwhelming majority of the people in the north, from taking forward this decision sooner. People I've talked to in Derry, and I'm sure it must be the same for many members, but they oscillate when they talk to you about these further restrictions coming in. They oscillate between people who are being absolutely fed up 9 months of restrictions after restrictions, think things are moving on, and then they're having to roll back. And to the other end of it, I meet people who just say, I want a total lockdown. Lock us down for 3 or 4 months, try and sort this out, see if we can get back to some kind of near normal. Because they don't want to see any more of their loved ones ending up in hospitals, because thousands and thousands more people have ended up in hospitals, and for many of them, as we said, unfortunately, tragically, in the morgue. The hope... Yep.
I thank the member for giving way. Will the member agree with me that There needs to be a strong, unified message coming from this Assembly and from the Executive as to the importance of these restrictions, because behind every single number that is a death of a loved one, there are family members, wives, husbands, children, grandchildren, brothers and sisters that are heartbroken by this virus, who have not seen their loved one from they entered hospital until they're carried out.
Thank the member for that intervention, and I'm very conscious, particularly in Strabane, of Mr. and Mrs. Ward, a mother and father, a family left devastated by their parents dying within 12 hours of each other. So, I mean, when we think about that, I think it's a very sobering thought for us all. And how could anyone not come together and have a unified position on these kind of restrictions? And of course, the hope is that the vaccines that have been or that are being clinically trialled, that they will receive the authorisation and become available and safe for us to see being rolled out soon. Now, again, as other members have said, once again, we find ourselves in the Assembly talking about regulations that are already in place. And there is no doubt, I think there's not a member of this chamber that is not frustrated about that kind of process, because it's not how we want to do scrutiny. And I think that all goes without saying. But we also recognise that we are in the middle of a global pandemic and things don't move in the way that they should. Yesterday, there were 351 people who tested positive of COVID-19. And unfortunately, some of them are going to end up in hospital beds and in intensive care. And NISRA confirmed, and we all heard this last week, that within a one-week period, 100 people died. So some people have questioned, however, the COVID-19 death rate. And, you know, as I mentioned, Mr. and Mrs. Ward in Strabane and all of the other people who have died within hours of one another, you know, I think that we all should challenge those kind of questions. Yeah, it's good enough for people, and of course they have the right to question that. But the evidence that we're getting before us about the number of people who have tragically lost their lives, that evidence is there for us all to use. We also know from the COVID-19 inequality reports that the infection rate in the 10% most deprived areas have been a fifth higher than the rate in the 10% least deprived areas. And we know from that report that the hospital admission rate of COVID-19 in the 10% most deprived areas was almost double the rate in the 10% least deprived areas.
On that very point, the member will understand that there is a lot of scepticism and indeed anger as to the side effects of lockdown in itself. And I look even at Professor Jack Lambert, the leading infectious disease expert in the Republic, who leads an Irish doctors group which presented a white paper to the government, and it said it is concerning that a single-minded fixation on lockdowns and COVID-19 persists to the exclusion of all other crucial to our public and health well-being. Lockdowns, as we have seen from the analysis, serve nothing other than to punish the most vulnerable in society. So while we have learnt a lot about COVID-19 and its effects and how to treat it, there also must be a move on in relation to how we respond to that, that being that lockdowns aren't always a simple answer. There is significant side effects that this House, and as members, we must take into account.
Of course we must take all of that into account. We all have people in our own family settings who are struggling with lockdown. But poverty is not new. Inequality is not new. Vulnerable people out there in our society, it's not new. We know that we have to have greater interventions. And when we look at the reports, the inequality report, when we see that in the 10% most deprived, so why do we have to tackle regional inequalities? Why do we need an anti-poverty strategy? Why do we need collective agreement to tackle all of that so that people can cope a bit better? There's no one making a decision to try to keep people away from having their civil liberties. I find that quite challenging, that we have removed people's civil liberties. But we're doing this because we're in a global pandemic, and of course it is a balance, and we have to try and get it right. So, you know, when we are talking about poverty killing people, we know that those on low income who work in the high exposed facilities, they don't feel, and some of them feel quite offended when they hear some of us say we are all in this together. Because see, if you're a worker on a low wage and living in poverty, but you're a key worker, or if you're a porter in a hospital or a domiciliary care worker, and thus you're more exposed to possibly catching the virus, then you don't feel like we're all in this together. So the chair of the BMA, Dr. Black, has told us that some hospitals, that they are hanging together by a thread. And it's hoped that these amendments, these restrictions that we're dealing with today, that the pressures will be taken off our hospitals, as in Altnagavin Hospital, in Derry and other hospitals across the north, where we know that in that hospital and in other hospitals, there are hundreds and hundreds of staff members off sick or self-isolating, and that's putting further pressure on the health service. So while some of these amendments before us today, Amendment 3 and Amendment 11, are tough, staff in hospitals who have been on the front line for 9 months are demanding that they are supported. And during debates like this, as MLAs, we raise issues that impact that COVID has had and the restrictions had on people's lives and livelihoods, and we've heard some of that here today. You know, in Amendment 11, it clarified that what businesses can and can't open, and as we say, that's already now in place. And I want to add my voice to those who have been calling, and this isn't about singling out a minister, but we need the Economy Minister to get schemes in place for the newly self-employed and sole traders, regardless of what constituency you come from. You must all be being lobbied by people who fit into that category, who want to work, but restrictions like these are preventing them from doing so. So the delays in devising a scheme is unacceptable. And whilst
I thank the member for giving way, and I think she strikes the right tone when she says that we are all getting lobbied in the nature of getting grants out to those that are in much need as quickly as possible. But would she accept that by actions of some within her own party in terms of the misuse of public money, when we've seen COVID grant money go to non-elected and elected officials within Sinn Féin's constituency offices, that meant that significant checks and balances had to be applied, which has meant, sadly, the slowing down of the timing in which we can get grants out?
Well, I'm very conscious of what the Audit Office had said in relation to the schemes and the kind of mistakes that were made. And we know what happened, and we know that the apologies that have been given for those 3 offices, the 3 Sinn Féin offices who received those grants. I don't know what's happened with the other 450 so members who also are people out there who received grants. I'm assuming all of them have been returned by now. But we do know that the Audit Office is saying that it was a very small percentage of risks. And there are thousands and thousands of businesses and people out there who are desperately looking and needing some help. And as we're standing here talking about these restrictions, representatives from Excluded NI, for instance, that campaign, and I could name many, they feel like they're howling at the moon, because almost daily they're calling, and look, this might be uncomfortable for you, but they're calling on Minister Dodds to introduce new schemes for businesses left out, who the Minister herself has said fell through the cracks, and yet they don't see anything coming forward. And, you know, given that the Minister has received substantive funding for such schemes, and we know that the Finance Minister to implement these amendments that are before us today.
I appreciate, to be fair, the member is responding to a point. I understand that, but I'm afraid that this debate is now veering off away from the regulations. So if we could just try to return to the content of the regulations. Thank you.
Amendment 11 that closed down closed down an awful lot of the hospitality sector and others out there. So, I mean, this is why these people who are desperately trying to get a scheme, because they feel that the protracted delay of getting money into their pockets of these workers and their families, these are the people that are calling for us as we are coming forward with restrictions like Amendment 11 and others to take account that there are people out there who haven't received a single penny in 9 months. And, you know, I think when we're talking about trying to get support, collective support in this chamber, well, we need support from society, from people outside who are listening to all of us for Amendments 11, Amendments 12, and indeed for face masks, for Amendment 3. We need to demonstrate competency and ability and show that we can act fast and smart, all within due diligence, and get financial support into the pockets and to the purses of those who need it the most. So I think if any minister is struggling with trying to do that, then the executive should look about giving that minister a helping hand to see if that can be brought forward. You know, life is challenging enough out there, and so for the 5 parties in the executive to ensure that people get support to live with this deadly virus and with, you know, these terrible restrictions on people's civil liberties and their lives, then we need to make sure that effectiveness and efficiency is the byproduct and the labels that are wore by all ministers. And these restrictions, take Amendment 11. The Committee for Infrastructure this morning had an informal meeting with taxi drivers. And once again, taxi drivers whose work was lost overnight. And just as they thought that they were getting things together, and then comes Amendment 11, and there's further restrictions put in place, that end up then that their customer base is no more. So once again, you know, we're having the closure of bars, the closure of restaurants, the closure of hotels, and that has a knock-on effect on taxi drivers who, like other people who want to work, but these necessary restrictions and the public health message is preventing them from doing so. So even though these restrictions mean that they have no income, they did play their part. And I think many of us know many taxi drivers who, throughout this pandemic, especially when people were shielding, and even now when we're dealing with these closures, as we are in Amendment 11, you know, they've went out and they take people to hospitals, they take workers to hospitals, they take them to care homes, they've done their best, they delivered food parcels, they delivered medicines, and we all know how they are valued. Yet they question and ask us, do we value them at all? Because some drivers did downgrade their insurance, but still they have a taxi policy. And yet those drivers who are looking now at Amendment 11, look at the restrictions that are in place, and before these amendments were introduced that we're talking about today, Amendment 11, taxi drivers were promised that they would be included in the Department for Economy's COVID restriction business support scheme, but just as these restrictions, just as Amendment 11 was announced, they were told that they were excluded from that scheme too. So they've been excluded from a scheme that's been put in place because of insurance and decisions that they had to make based on, and now they're being excluded from this. So as I say, I think we need to give a call out and let taxi drivers know that whilst Amendment 11 is going to impact on their businesses, because there's nobody on the streets really, because we're asking people to stay at home. So there's nobody in the pubs, there's nobody in the hotels, there's nobody in the restaurants to take to or from the restaurants. Those taxi drivers need support. So generally, even the fed-up people who are frustrated with 2 more weeks of these amendments that are in front of us today, they did listen, and people have listened, to the chair of the BMA, Tom Black, when he says that reopening the hospitality industry would be, and I quote him, an act of careless vandalism. And you know, that's hard for...
I've listened patiently to the member, but the thought that keeps occurring to me is she's lecturing us through the surrogacy of Dr. Tom Black about doing the right thing. Did she ever think of any of that when she was leading the colour party at a funeral attended by thousands of people? Did she ever think of doing the right thing, or is this just for everyone else, but not her and her cronies?
Of course, we've all listened to Tom back and heard what he said. Bobby Story is dead 5 months. And I suppose, like people in this chamber, we would send our thoughts and sympathy to his family. Because, I mean, obviously it's been something that there's been quite an ongoing daily exchange of views in relation to what happened, and Sinn Féin has made it clear that we are aware of the impact that that had on the public health message and apologised for that. So can I say that in relation to Tom Black, who's an eminent doctor, and of course we would listen to him, you know, it was also hard for people in the industry, in the hospitality industry, for instance, when they heard about more restrictions and Amendment 11 coming in place, and when they had hoped they were going to open, and then they were told they weren't going to open, because they spent thousands putting measures in place. And they opened, at the time when they opened in the summer, you know, they were trying their best to keep people safe by putting that. But some in the hospitality sector, when they heard about Amendment 11 coming in and further restrictions, and they weren't going to get opening as they had hoped they would, and many others as well, when Amendment 11 came in, I mean, I'm assuming that other members have heard from people who are questioning why schools are open. But there's no doubt that children in school...
Point of order, Mr. Tim Allister.
Mr. Deputy Speaker, could you advise the House if the Amendment 11 before us today says any of the things that the contributing member is saying it refers to?
The Health Protection Coronavirus Restrictions number 2, Amendment number 11, Regulations Northern Ireland 2020, clarifies the meaning of self-catering accommodation, provides for a person to take part in indoor exercise or sport with a carer or carers, requires the closure of hostels and similar establishments with certain exemptions, provides that an exemption in relation to caravans also relates to motorhomes, provides that hairdressing, make-up and other close contact services may operate in film and television production, and defines certain terms. Number 12 provides for physical education to take place in schools and other educational settings, and provides that tables or other facilities in an area adjacent to hospitality premises are to be treated as part of the premises. Number 3 extends the requirement to wear a face covering to post-primary school children on school transport and on other public transport. It's now been read into the record, and everybody now knows what we should be talking about. Mrs. Anderson.
Thank you. And it's on that vein that I talk about Amendment 12 in terms of children at school, because that has provoked some conversations with people with regards to, and of course, we need to ensure that the children have playtime at breaks and lunch, rather than remaining in one small room for up to 6 hours, and that's where Amendment 12. There's no doubt that children's education is paramount, but the point that I wanted to make here in regards to the playtime and what this amendment actually tells us in terms of Amendment 12, it can be challenging because you have staff's absences are placing huge strains on schools. They're doing that in Derry and across the north. And those staff left in schools trying to cater for, of course, whether it is blended learning or making sure the children get outdoors to get their exercise, and all that Amendment 12 actually deals with, that during the 2 weeks of the restrictions, when other places are closed, staff members, there's an anxiety being fuelled by that, because staff members are feeling somewhat isolated and a bit at risk. Now, That's something that I just think that we need to acknowledge, because when we're talking about mental health, we're talking about the level of anxiety, then that's not good for staff or pupils either. So if we do, as the Vice Chair has said, of the Health Committee, look, if we do what Amendment 3 is encouraging us all to do, wear face covering, and then coupled with washing our hands and keeping our social distance, businesses maybe, hopefully, will see the opening of their facilities on the 11th of December. But and I would ask and echo the question that Member Pat Sheehan had asked as to whether you, Minister, the Health Minister, whether you bring forward recommendations to the Executive about further restrictions post 11th of December, because the industry needs to know that now, not on the 10th of December and not at lastminute.com, because we all want to be able to have some form of new normal exchanges with each other as we continue to practice these measures. You know, no one wants these restrictions that we're discussing here today in place. No one wants to catch the virus either. But given the death toll that we've all mentioned, and the pressure on the hospitality setting, and the real pressures that are on our hospitals, then these extra 2 weeks do offer us the chance of pushing the community transmission as low as possible to allow, hopefully, for a safer Christmas for everyone. I support the amendments. Thank you all.
Thank you. I call Mrs Sinead Bradley.
Thank you, Mr Principal Deputy Speaker, and I rise on behalf of the SDLP to acknowledge what are ultimately clarifying amendments that have come to the House today. And I do recognise we are in a global pandemic. We are working a system that is far from perfect or ideal. Decisions are being made at executive level. Announcements are being made. And I, like every member in this House, regardless of what party you're in, will be inundated almost instantaneously, either by text message, email, asking what exactly do these regulations mean for me, for my business, for my school, or for the organisation that I represent. And I do appreciate that this piece of work in front of us today is almost the latter end of that process. Today we are looking at the amendments that were required to bring into check the regulations that were quite hastily, in many cases, put down on paper and brought through the House. That said, many amendments that come through in this form are as a result of those phone calls, of those texts, of those messages that we get from people on the ground who are going to be implicated by the announcements that have been made. And therefore, I do get frustrated, as I'm sure many do, that when the announcements are made, the clarity is often not there. But also, as a member of this House, I have yet to find the correct, quick, swift way of getting that clarity. It has moved, the goalposts keep moving on the emails that I should be using, the websites I should be visiting, and it's a moving feast. And I really think there is a huge piece of work and a problem that has to be ironed out in how we communicate better from the point where the announcement is made right through the process to this point where we have clarifying amendments in front of the House. And I say that, and I know, and I've heard, and I would like if the Minister could clarify it for me as a member of that executive, that money was set aside for that purpose. Money has been set aside purely for communication. And I yet have to see the outworkings of that. And I would appreciate if the Minister could enlighten me on that. I think today it is an unfortunate, and I speak to the process that brought these amendments to the House. And on this occasion, it happens to be that it's the Department of Economy and the Department of Education who are the foundation departments behind these amendments. And I think as part of that communication tool, it would be helpful, regardless of who the Minister is and the amendment in front, it would be helpful to use this House as the place to really speak directly, not just to members in this House, but to the media and the public who are watching, to give the rationale behind the amendments, to give the voices of the stories that they heard that brought them to this consensus, and to explain it so people understand it. Because, Mr Speaker, what I have noted is, whilst there have been very harsh regulations imposed on almost everybody in some form, when we communicate the logic behind those regulations, people are very understanding, because business people are also mothers and fathers. Nobody is standalone in one little part of their lives. COVID-19 rippled right through every part of our economy, our community, and it touches every house and household and every individual. And I think we are definitely failing in our communications and how we explain the rationale that went behind a lot of the amendments that have been arrived at here today, and indeed the original regulations. But what I will give way, yes.
I thank the member for giving way. I think the member hits on a very key point. A lot of us, as has been rightly pointed out, are inundated with questions from businesses every single day. Should there not, would the member agree, should there not be a helpline established for MLAs to get the information quick and fast in the one place? And also, would the member agree that this isn't rocket science? Communication should be very clear. This is a relatively small region. It has 6 counties, 11 council areas, 18 constituencies. This should be very manageable and very doable very quickly.
I thank the member for his contribution, and I think it is a very clear one, a clear ask, and something like a helpline would certainly help, I think, every member in this House, who will ultimately then spread that information very quickly to those who need to know it. And I appreciate that sometimes the logic or the nuance behind some of these is quite complex. It's not as black and white or simple to relay, but when we take the time to do that, people do understand it and they do get it. And ultimately, whilst we have this clarifying or these clarifying amendments in front of us, and it does give detail against each of them, and I have to admit, the former member speaking, I did do a revision on whether I was actually looking at the right amendments, because while I would ultimately love to be speaking to the High Street voucher scheme, I see that it has no part in number 11 amendments, nor do the taxi drivers, which is a very, very important cause. But I think I would be swerving far from the amendments in front of me to bring that to the floor, and I won't confuse the matters further. But what I do, and I have to thank the Minister for Health for coming forward with these today, but I'm not sure that it's good practice that he does, to be quite honest, because I do think I would have liked an opportunity to have the Minister behind these in front of us, because we know we missed a lot of the scrutiny. That had to happen. You know, the speed that was required did bring that about. But that said, this was an opportunity to put on public record. I would indeed.
Thank you very much indeed, and thank you very much indeed for giving way. I noticed that the Education Minister was today on a Zoom call that he seemed to be pushing out on Twitter. Do you not think it would be more appropriate if the Education Minister took the time to be here to explain to the members what we actually wanted to hear from these regulations?
I take the member's point, and I am not privy to where the Education Minister is today. And I don't say this to get at the Education Minister or the Economy Minister. I genuinely do say it across the House. Wouldn't it be best practice for us to have the thinking and the logic delivered by whoever the Minister is behind as the seed to the amendments required? And I appreciate that it's even at that point. Had the ministers been here today, I appreciate it that they will be speaking retrospectively. They will be bringing something that has already happened, and that is something that would be difficult to iron out of the system, but I still think their being here would have had great value. So based on that, Mr Speaker, I do recognise the clarifying detail that is in these amendments, and I note them, and I certainly would urge, like others have done, I would urge the public, remember, this is about you. It is about you, your family, your neighbourhoods and your community. So whilst there is no denying credibility has been shaken in this place in some of the people who have to step forward and deliver this, I think ultimately the people of Northern Ireland know better. They know that this is about them standing up for their communities and their loved ones and the people around them. And they ultimately know how thankful we genuinely all are to those healthcare workers who are stepping up day and daily putting themselves at risk for the safety of others. And I also would like to close my remarks by paying my condolences to all those families who have been affected by the loss of loved ones during COVID-19 to date. Thank you, Mr Deputy Principal Speaker.
Mr Alan Chambers.
Thank you, Mr Principal Deputy Speaker. I was disappointed to learn from the Minister's opening remarks today that 2 ministers in the Executive had declined to accede to his request that one or both of them would lead on the Assembly scrutiny of the amendments that they had specifically requested, and indeed that are in front of us at the moment. I understood that the Executive had pledged to move away from the ministerial silo mentality to take collective decisions and, more importantly, collective responsibility. It didn't work before, and to echo the words of Mr Middleton, it isn't helpful now. Surely, if ever there was a time for such a united and collective approach, it must be in the middle of a second surge of a worldwide deadly pandemic. And that should include this House and not just the Executive. Tomorrow this House will be discussing a private member's motion on the rollout of the COVID vaccine. This enormous and unprecedented exercise will require the full support of the Executive. It will not benefit from any minister going on a solo run to sow seeds of doubt, nor the intervention of elected members from outside this House voicing bizarre opinions. The failure of ministers to take a degree of responsibility for regulations they have called for is at odds with the previous commitment of the First and Deputy First Minister that regulations would be tabled and led in the Assembly by the relevant minister. There also seems to be confusion among some members of this House that all the regulations and the guidance issued during this pandemic have been other than decisions taken by and on behalf of the Executive. It has been very noticeable that some members appear to target the Minister for Health when demanding answers around various elements of regulations. Now, it does seem to me to be a classic case of shooting the messenger, in that Minister Swan is normally the conduit to the Executive of the current medical and scientific advice. The decision whether to accept or ignore this advice lies with the democratic vote within the Executive, or, as recently, rejected by the use of the cross-community vote veto, a decision that may still have negative consequences for the health of the people of Northern Ireland. Turning to the regulations before us at the moment, they have been in operation for a few weeks. They were scrutinised by the Health Committee a few weeks ago, and as such, it is a bit of an academic exercise coming before the House today, but protocol has to be followed and satisfied. Hopefully, as we move into the phase of beginning vaccinating, we must congratulate the scientists who have brought this vaccine forward in such a timely manner. All of us in this House need to commit to supporting the efforts to vaccinating our entire community, and also to support the efforts to restore all other services offered by our NHS. Maybe those who hurl from the ditches will stop trying to outdo each other and sniping at the Minister and his department, and accept the fact that both the DUP and Sinn Féin had 2 opportunities to take the health portfolio, and that was before we fully understood the implications of the pandemic coming towards us at that time. Tackling growing waiting lists was the major challenge back then. I'm grateful that my colleague Robin Swan had the courage to take up the challenges when others ran away from it. And I think the work that he has done to date has been recognised by the vast majority of the public. We know that other hospital services have been curtailed at the moment. It's a regrettable consequence of this virus, and it's also a stark reality of a price we're having to pay because of this virus. But that reality seems to present difficulties to some members to accept or to understand. And I'm sure the Minister would have no difficulty in his winding up speech today to confirm that no urgent or immediate life-saving medical intervention has been denied to anyone or will be denied to anyone. These regulations, along with others, if they are followed and the rate of COVID transmission is reduced and reflected in hospital admissions, then normal services can be fully restored across all medical disciplines. Now, I've listened today and on Thursday at the Health Committee to Mr Buckley passionately making the case for gyms to reopen. And I'm just wondering, has he taken advice from Professor Gabriel Scally on this issue? I know that he holds the professor in quite high regard, but actually the professor, he would be advocating total lockdown. And I think I take the point of Mrs Bradshaw made. It is only for 2 weeks. It's only until the 11th of December, and it will be reviewed. No, I'm just finishing. In the meantime, I and my party fully support these regulations before us today. Thank you, Mr Principal Deputy Speaker.
Mr Daniel McCrossan.
Thank you, Mr Principal Deputy Speaker. Can I first of all, Minister, put on record my sincere appreciation and thanks to you and your private office for your intervention for help last week in relation to a constituent of mine. It came as a great comfort and support to Frank Tracy and his family. It's with much regret that I must say that Frank lost his battle with this virus in the early hours of Saturday morning, leaving behind his lovely wife, Jude, his daughter, Anita, his 2 sons, Matthew and Darren. I can safely say, Minister, for discussing these regulations, that the journey that I've been through with the Tracy family in the last 10 days has brought this virus home hard. To hear a wife on the other end of a phone cry and plead, a daughter and 2 sons, that they would never see their father again as his condition worsened in Galvin Hospital. The nurses in that hospital on the early hours of Saturday morning held Frank's hand and sung to him to comfort him and calm him in the final minutes of his life. It came as a great comfort, Minister, to Frank's family to know that those nurses went the extra mile to support their father and a husband in the final hours of his life. Frank called me last Tuesday on the way to this assembly, knowing that his battle with the virus was coming to an end. And he had this to say: please get the message out there loud and clear. I have done everything, as have my family, to ensure that we followed the regulations and kept safe. He admitted that he couldn't beat the virus. A man that is very fit and healthy and able, energetic, loved life and loved his family. He asked that people take this seriously, that it could end a life very quickly. And in Frank's case, just over 1 week. I want to put on record the sincerest appreciation to our healthcare staff that have to comfort people in their final hours, that ensure that they're at peace and that they're not alone, which is very, very difficult indeed. And Minister, to thank you, because I know the difficult job that you have and the burden that is on you to try and help and support people throughout this pandemic. The message is simple: wear masks, wash hands, and keep your distance. And I was a personal friend of Frank's, and he was a man who was very much loved in the community of Strabane. This is the 3rd death in the space of just over a week, and the Ward family, as Ms Anderson has rightly mentioned, lost their mother and father. Nothing halts complacency like a sudden and painful death, and that family have suffered incredibly. And that is why these regulations, although they're clarifying measures that are in place, are so important and essential. We all tend to forget that our actions or complacency can have dire consequences for another person or their life. And that is why our society need to hear these stories about the journeys that our families out there are on, and the coldness of the process and the journey. When a person is taken away quite ill into the care of our hospital, the family may not see that person again. That is a very harsh and very painful reality. They weren't allowed awake, and there's no wider family or friends to attend a funeral. I can tell you, Minister, I've been helping people right throughout this pandemic, and that opened my eyes this week. I've never had a phone call like it. But in Frank's honour and memory, I just thought it was important to put on record today just how important our healthcare staff are, and to offer the condolences of this House to his family, his wife Jude, his daughter Anita, 2 sons Matthew and Darren, and to urge this Assembly to work as strongly together as we can to protect human life. Nobody wants these regulations. Nobody wants businesses closed. But nobody wants to lose a father, a mother, a daughter, a son, or a grandparent either. And that is what's most important. They're irreplaceable. Thank you, Mr. Principal Deputy Speaker.
Thank you, Mr. McCrossan. Question time begins at 2, and I therefore suggest that the House will take its ease until then for question time to begin. This debate will continue after question time, when the next member to speak will be Dr. Steve Aiken. If members could just take their ease and don't forget to clean the surfaces and stuff if you're leaving the chamber. Thank you.
Members, we now return to the health protection coronavirus restrictions debate, which was had commenced before question time, and I now call Steve Aiken.
Thank you very much indeed, Mr. Deputy Speaker, and may I thank the Minister for his forbearance in the remarks he's made so far. But I just wanted to say, before I specifically ask a question of the Minister, I think just before the Assembly rose for questions from the Executive Office, there was a very powerful testimony from the MLA, Mr. Daniel McCrossan, about the Tracy family. And I don't think any MLA who was in here who would have heard his remarks could have been failed to be moved in compassion, not only for that family and all of the families who have suffered from COVID, but above all for the staff and the excellent staff who went above and beyond the cause of duty to be able to support that person in their need. And I think I would like to put on record from this Assembly and all members of this Assembly to both the family and to the staff of the NHS for their outstanding work and what they do. That said, Mr. Minister, I have noted that today the Economy Minister and the Health Minister, who should have been here to be able to provide... Sorry, did I say economy? Sorry, my apologies to the Health Minister. May I say to the Economy Minister and the Education Minister, who should have been here to answer questions. There are some particular areas to do these regulations number 11 and 12 that should have been dealt with and should have been dealt with by then. And I think all of us MLAs cannot be failed to be concerned about the lack of information, particularly coming from the Department of Economy, where members of the excluded from Northern Ireland and other business people are still waiting 7 to 8 weeks now for any guidance or any support. And Minister, since it seems to be only you who seems to have the courage to come and sit in front of this Assembly and to answer questions even from other departments, can you pass on specifically to the Minister of Economy to ask her to expedite the movement of payments to those who need it, expedite the movement of payments to those of the excluded, and could you also ask her, Minister, how she can give out advice through her department and also through InvestNI that these people should just wait until the website updates itself? That is the kind of level of guidance that's being given out there. And that is not the kind of thing we expect.
Can I draw the member back to the restrictions?
It is indeed within the restrictions, Mr. Deputy Speaker.
Order, order. I would ask the member to draw back to the particular regulations we are debating here today.
And thank you very much indeed, Mr Deputy Speaker. And I think in that case, I think I have made my point indeed about the Minister of Economy. Now I shall move swiftly on to the Minister for Education. The Minister of Education again should have been here in front of this Assembly to be able to presenting these rules to us as well. But one of the things I think, and indeed I make a declaration here as a governor of a school, one of the things we've been struck by is the paucity of information and communication coming from the Department of Education that is coming to MLAs. And again, Minister, since you are the only one who seems to be able to come and explain these regulations in front of the Assembly, could you take it back to the Minister for Education and ask him to actually come in front of the Assembly, or better still, actually talk to the schools of Northern Ireland and give them the information they are due? And on that, Mr Deputy Speaker, before you bring me back to the rules and regulations again, the Ulster Unionist Party fully supports the regulations 11 and 12 and the regulations set before us. Thank you.
The remaining members who should have been here are not present, so I now return to the Minister to respond to the debate.
Mr Deputy Speaker, I had actually heard Mr Speaker, Mr Principal Deputy Speaker and then Mr Deputy Speaker, so I'm now my third Speaker since we started this debate. Look, I'm grateful to members for their contributions to this debate, and I appreciate the degree of goodwill that this Assembly shows towards this unusual process, whereby the role of legislative scrutiny is applied only after the event. Nevertheless, I believe it is important that this scrutiny takes place in order to examine and comment upon measures that have been taken. In the current context, things move fast, and the observations and concerns of the Assembly members are taken on board as we develop policy and work on the next set of amendments. I also believe that the public must have confidence that the Executive is not acting without scrutiny. And for that reason, Mr Deputy Speaker, I will respond to a number of questions raised by members during the debate. In regards to comments made by the Chair in regards to the policy development of these regulations, as I've set out, and in regards to the useful conversation I've had with the Committee Chair, these amendments are led by policy asks from other departments and other ministers that we follow up on and then try and attempt to put into regulation that can be understood, but also can be understood but is also legally enforceable as well. In regards to the quality issues that are challenging within these regulations, because we all recognise, and I recognise, it's not something that in normal situation that I would be bringing forward. So it's about that balance of detail to proportionality that we always seek to address. And in regards to, I think the member then made in regards to comments in regards to face coverings and the benefits that those do bring about in regards to post-primary and not home to school transport. In regards to Mr Gildernew then moved on to comments as a Sinn Féin member in regards to the challenges of communication. And again, him and I have had many conversations that we've had at the committee, as well as the importance of communication of these regulations, why they're necessary, what the benefit they actually bring in that regards to supporting an already stretched and overstretched health service. And I thank the member for his continued stance as chair of the committee in bringing forward that single unified message that him and I have been able to achieve in regards to the need of these regulations and the importance that they do bring as well. In regards then moving on to comments by Ms Pam Cameron, the Vice Chair of the committee, who again I thank for her commitments and support in her role and the continued role that she plays in supporting the health service. And again I think and part of her comments was in regards for support for businesses and individuals through what are tough times. And that is something that I have often highlighted, Mr Deputy Speaker, that the unity of message and the unity of purpose coming out of the Executive at this time is more crucial than ever. In regards, she raised specifically was the amendment that was made at the request of the Education Minister in regards to PE within schools. And this is when the regulations were laid. It came to the attention of the Department of Education that the restrictions upon sport did not exempt specifically school PE. And it was until that was resolved that the Department of Education advised schools that PE was to be paused. So the resolution was provided by these regulations as quickly as possible, as although that was when PE was stopped, it was neither the intention nor the spirit of these regulations to do that. In regards to comments then from Colin McGrath, and specifically in regards to how these regulations are being handled, are being brought forward, and I think one of the words that he used is how the general public are suffering these regulations. And I will say to the member, the reason that I suppose the general public is suffering these regulations is so that we can ensure less of them and fewer of them have to suffer COVID. So that is the reason they are. But in regards to timing, Mr Deputy Speaker, I will say it's the Assembly's requirements for the input of the Examiner of Statutory Rules and the timing and scrutiny actually provided by the Health Committee that allows us to set the process. So in any process that would bring these regulations to this House before that work had been completed, I think would meet equal and opposite complaint in regards to that process. But in regards to the speed that these regulations and the detail that some of them do bring forward, there is a challenge there, and I think it's a challenge that we all want to see rectified and better. In regards to Ms Bradshaw, she raised about the technical nature of these regulations, because that's specifically what they are, and all the regulations being brought forward, they were technical amendments that were necessary to correct those anomalies or those queries that have been raised. And I think it was Sinead Bradley also raised that it is only with the question when people come to look at these regulations as to how they affect their everyday way of life that we can fine-tune them and have them in a position so hopefully, so if they are ever needed again, and hopefully not needed again, that we've already got through those hurdles and those questions so they aren't brought about. In regards to comments then from Mr Middleton, I would agree fully with him that there is a need to move away from the politicalisation of this issue. And Mr Deputy Speaker, I have been calling and asking for that for quite some time. And he also asked that on these issues all ministers need to be heard. And I can say quite happily that I would happily give way to any of my ministerial colleagues who want to step in and move any of these regulations in the days coming forward. In regards to Mr Sheehan's comments then in regards to the protection of our health and social care system and the realisation that that is the driving need behind these regulations, with still over 427 inpatients within COVID inpatients within our hospital system at present, whereas in the first wave our maximum was 322. So, Mr Deputy Speaker, we have over 100 additional COVID patients being supported across our hospitals today than we had before. So the need for these regulations is specifically that, and I think that was also something that Ms Anderson raised in regards to our healthcare system and the pressures that it was currently under. But there is moving back to queries that were brought forward in regards to time frame and legislative timetables. One thing, Mr Deputy Speaker, is that COVID doesn't respect any timetable or any calendar or any plan that we set. If only it did, it would be far easier for me, my health service and the healthcare workers to work with. But one thing I would, and I've said this many times, and echoing Mr Sheehan's comment when he talked about those siren voices who seem content on undermining what is a sound health message. And that just doesn't come, that just doesn't come out of frustration. Sometimes it just comes out of pure bloody mindedness, Mr Deputy Speaker, excuse my language, because that's That's what often I get from our frontline healthcare workers when they hear those people who are determined to undermine what is a sound health message, and a sound health message that doesn't always and doesn't have to necessarily always come forward from our political leadership, but is welcome when it does come forward in a united front. But it's a message that does come forward from all of our healthcare workers, no matter where across the system is. Mr. Sheehan also asked in regards to could I set out today what it will look like following the 11th? Well,
I was getting a bit ahead of myself. I meant to say this week rather than just today.
I'll thank the member for his gratitude. Then, if he gives me a week, I'll be more than appreciative. So I was about to say that setting something out today would be highly challenging, saying we're working through these regulations which came into effect quite some time ago. And if only I could set the executive's timetable, as I'm sure the member would wish I could as well. In regards to comments, then moving on to Ms Anderson, in regards to where we are, and I think one of the things she did raise was the prospect of a vaccine. And one thing again, Mr. Speaker, Deputy Speaker, that I would ask, that this House and the members of it could get behind the delivery of a vaccine and actually sharing the benefit that it will have to the people of Northern Ireland and returning to the normality that we all know and want to get back to. And Mr. Deputy Speaker, I'm back in the House tomorrow afternoon on a debate specifically on that point. Sinead Bradley then asked in regards to communications and the money being well spent and where it is spent and how it is spent. The communications budget for COVID actually sits within the Executive Office and has been utilised in bringing forward social media, TV adverts and printed adverts as well. So that has been utilised in those regards. In regards then to Mr. Chambers, again following up on Mr. Sheehan's point about a phrase that has been often used in here about the herders on the ditch. Those individuals who seem to have the comfort of sitting back and the ability to combat COVID-19 with 2020 vision and the clarity of education, degrees and qualifications that they receive from social media. Mr. Deputy Speaker, I only wish that I had the gift and the power to be able to combat COVID-19 and this pandemic from the comfort and security that many of these people do, and also with that ability of 2020 vision. Because I can assure you, Mr. Deputy Speaker, if I had the ability of 2020 vision, it would have been a different day in here on the 11th of January. In regards to Mr. McCrossan's comments, and I think my party leader, Dr. Aiken, summed it up in regards to the experiences of the Tracy family. And unfortunately, Mr. Deputy Speaker, their experience, they're not on their own when they come to that message and that suffering that so many families across Northern Ireland have had to endure. But I think, as Mr. McCrossan explained, Frank's message should be one for all of us, and that's the support and thanks for our health service, and in regards to what a terrible virus COVID actually is. And in following that, I thank the members and others in this House for their acknowledgement of the dedication and the extra mile that our healthcare workers are still going and still will have to go. And that's healthcare workers, Mr. Deputy Speaker, who are across the healthcare family, should it be our GPs or community pharmacies or nurses or doctors, the porters, the cleaners, the canteen workers, who all play a part in our tackling of this dreadful pandemic and this dreadful virus, which hope does come, Mr. Deputy Speaker, with the opportunities that a vaccine will bring, that mass testing may bring, but we still need to get through these next few days, weeks and months while this virus is still with us. The last contributor, Dr. Egan, made a number of calls to the Minister of the Economy and to the Minister of Education, and I'm sure those ministers will hear that and hear those calls, because I'm sure if they don't hear them directly from the member, they'll hear them from their departmental staff and advisers. Mr Deputy Speaker, we all have a responsibility to help curb the spread of the virus. We do that by maintaining social distancing, maintaining good hand and respiratory hygiene, wearing face coverings, self-isolating immediately if we experience any symptoms, including a new persistent cough, a fever, or a loss of change or smell or taste, seeking a test if we experience any of these symptoms, downloading the Stop COVID NI app, and complying with the restrictions in place. Mr Deputy Speaker, by following this advice as we go about our daily lives, we can protect ourselves and others from serious illness, protect our health service and our economy, and help avoid further prolonged and more stringent restrictions. Mr Deputy Speaker, I move these regulations.
Members, the question is that the health protection coronavirus restrictions number 2, amendment number 11, regulations NI 2020 be approved. All those in favour say aye. Aye. Contrary, no. The ayes have it. The ayes have it. We will now move on to the second motion on the health protection coronavirus regulations, which has already been debated. I'll ask the clerk to read the motion.
That the Health Protection Coronavirus Restrictions number 2, Amendment number 12, Regulations Northern Ireland 2020 be approved.
I now call on the Minister to move the motion. The question is that Health Protection Coronavirus Restrictions number 2, Amendment number 12, Regulations NI 2020 be approved. All those in favour say aye. Aye. Contrary, no. The ayes have it. The ayes have it. We will now move on to the third motion on the Health Protection Coronavirus Regulations, which has already been debated. And I'll ask the clerk to read the motion.
That the Health Protection Coronavirus Wearing of Face Coverings Amendment number 3, Regulations Northern Ireland 2020 be approved.
Again, I ask the Minister to move the motion.
Moved.
The question is the Health Protection Coronavirus Wearing of Face Coverings Amendment number 3, Regulations NI 2020 be approved. All those in favour say aye. Aye. Contrary, no. The ayes have it. The ayes have it. I'll ask members to take their ease for a few moments.